actually needs therapy?
Noticing that you're not feeling like yourself, avoiding your friends or social activities, changes in appetite, more frequent headaches or GI problems, trouble sleeping. Is it a bad day, or how long have I been feeling this way?
A lot of people are still very skeptical about going to therapy. This old school kind of idea, no, you don't need therapy.
Many of us will lean on our friends and our loved ones. A therapist is going to be different. They're trained to be neutral. It's all about what is best for you. Take a look at the potential benefits. There's just so much that can be gained and not a whole lot to lose.
I scroll TikTok to the point where it's doom scrolling. Is it really that unhealthy?
Doom scrolling can often bring on stress, negative feelings. You're not enough, you're not skinny enough, you're not exercising enough. Stop scrolling. It can be really damaging to get those subliminal messages, and they make us feel poorly about ourselves.
I think everybody needs to be a little bit kinder to themselves. Mental health is something to take serious. Hello, everyone, and welcome to BTW, Bellabeat Talks Wellness podcast. Today, we have an incredible guest with us. Her name is Melissa. She is an LPCC, which means Licensed Professional Clinical Counselor, and she's also the Senior Clinical Operations Manager at BetterHelp, which sounds amazing and sounds like a pretty big job. That's awesome. So, Melissa, hi, and welcome. Thank you for being with us today.
Hi, Melanie. Thanks so much for having me.
Awesome. Why don't you start us off with just a little bit about you and BetterHelp as well?
Sure. So I'm Melissa Hummelt. I'm in the Bay Area. I've been a therapist for over 10 years. In my current role as a Senior Clinical Operations Manager at BetterHelp, I work alongside a team of other licensed therapists where we're focused on making a quality platform for both therapists and clients and making therapy more accessible for everyone, which is really BetterHelp's main goal as the world's largest online therapy platform.
That's great. So I'm just going to start us off with the question that I'm sure everybody wants to know. Who actually needs therapy?
This is a great question. And you're talking to a therapist. I'm going to say everyone needs therapy in some way. We all deal with stressors. There's so much suffering in the world, and stress can be really hard. Negative stress, positive stress, changes that we deal with. And having a safe space to talk about that and process that is really, really valuable. Life can be so fast and it can move so quickly, and we become products of our habits, and we can sometimes even get stuck in a rut sometimes. And therapy is a great way to talk about literally anything that is challenging for you. I'm thinking back to just a couple of years ago in the pandemic, we were all under so much adjustment and stress and change and unknowns. And I think virtually anybody could have benefited from therapy at that point. So really, it can be for anyone and for lots of different things. So, and I hope we can talk a little bit more about that throughout.
Yeah, absolutely. I would love to. But you said something really interesting that I hadn't heard before. You said positive stress. I feel like I'm aware of what negative stress would be. I go through it in life. But what exactly is positive stress?
Yeah, stress isn't always just a response to something negative, and I'm putting negative in quotes. There are a lot of positive things like a new relationship or a new job or becoming a parent. These things are all super wonderful and great, but they can be super challenging as well and be really stressful as a result. So yeah, I think it's an important thing to kind of recognize where our stress is coming from. And sometimes it's coming from things that we wouldn't necessarily associate negative
with
feelings
stress.
with.
Yeah, absolutely. And do you have any helpful tricks on how, or maybe tips on how to manage a sort of positive, stressful situation versus a negative situation as a licensed therapist, in your professional opinion?
That's a really great question. I think from either positive or negative stress, it can show up in so many different ways for all of us. For some of us, stress shows up very physically, like more frequent headaches or GI problems, trouble sleeping. Some of us will notice more of a change in our emotions, like are you feeling a little bit more irritable lately with your loved ones or your colleagues? So it's going to look a little bit different for everyone. And I think it can show up, have those same signs and symptoms with both positive and negative stress. So I think one really important thing is to get support. And I know many of us will lean on our friends and our loved ones. Therapy is also a really great resource here. Finding other people that are in a similar kind of phase of life or have similar interests as you can be a great place to find like-minded folks and get some social support. That is so huge in just leaning on other people and sharing our experiences.
Is there ever a negative side to leaning on people instead of, considering a therapist? So I know I have a friend, she doesn't want to go to therapy because I give her really good advice. And I tell her, I'm like, but I'm not a licensed therapist. I don't have room or the expertise to like guide you or to be like that sort of support that a therapist could be. So what are your thoughts on people that, lean more on their friends rather than on therapy?
Yeah, I think it's really important to understand the difference. Friends can be an amazing resource, and we need to have social outlets and people who love and care about us. A therapist is going to be different in that they're trained to be neutral. They're going to have your best interests at heart. Whereas if you're talking to a friend, they can't really tease out their part in the dynamic. Friendship is a two-way street. Whereas in therapy, very client-centered. It's all about what is best for you. The therapist is meant to be someone who can mirror back, give you feedback if that's what you're looking for, help you problem solve alongside you. Whereas a friendship can get a little messy sometimes, depending on what it is that you're talking about. But good question, because both are so important, but they're a bit different.
It is a bit different. And, if it push comes to shove and you're really going through something, then it is recommended to speak to a licensed therapist. I know I can give the best advice in the world, but I actually just started therapy recently with BetterHelp. My therapist, she's really great. She's really wonderful. And I've only been with her for about 3 weeks now, but I've already felt the benefits from her that I wasn't actually getting from my friends. She's very resourceful and very knowledgeable. So I have to give kudos to her for that. But I'm not a skeptic when it comes to mental health. And I know even in the world that we live in today, a lot of people are still very skeptical about mental health and about actually going to therapy. It's sort of this old school kind of idea that, you don't need therapy, or mental health is, you're happy or you're sad or you're mad. What would you say to these skeptics when it comes to getting them on board with believing that mental health is something to take serious?
Yeah, I would say to the skeptics, take a look at the potential benefits. Therapy can really help us learn more about ourselves and how our minds work. It can give us a safe space to process and navigate our feelings, which can in turn promote self-awareness. And it's really designed to be a place where you can get different perspectives on your challenges, have someone who can help you find healthier ways to cope or problem solve the challenges that you're facing. And at a bare minimum, it's a good way to carve out time just for you to reflect and talk about who you are, how you're really truly doing with a professional who's trained and who cares and has your best interest at heart. So there's just so much that can be gained and not a whole lot to lose in trying therapy.
Yeah, I was going to say, is there really anything to lose? I wouldn't say you lose time because you're gaining a lot of insightful insights about yourself during that time. So you don't even lose time. There's really not, I can't think of any negatives to therapy personally.
It can be really difficult. It can drudge up a lot of really deep-seated stuff, and that can be a difficult process, but it is part of the process, and it can just allow you to do something different with that stuff that we tend to carry with us over time. So it can be challenging. I think it's important for people to know that.
Yeah, unpacking the baggage that you carry, it can be stressful. Yeah, absolutely. When it comes to you and your profession, what is your specialty? I know all therapists usually have specialties and things they focus on. What are your focuses?
I specialize in working with adults and really primarily with anxiety and depression, stress, life adjustments, and then substance abuse as well.
Wow, that's really impressive. That's really impressive. And so I'm an anxious person. I have diagnosed anxiety, OCD, and depression. And so I am always looking for tools when it comes to my anxiety, because that seems to be my best friend. My anxiety is always with me. But sometimes I don't really know what to do in the moments when I'm feeling anxious. Do you have any tips or tools that we can share with the audience when it comes to anxiety?
Yeah. I think my first tool or tip is just to think about what can I implement into my life daily, because managing stress or anxiety shouldn't just be a reactionary thing that we do once it gets to be all too much, but rather something that we can do ongoing to take good care of ourselves. Um, and so I usually start with just looking at how are we taking care of our bodies. And that doesn't necessarily mean having to have a 30-minute structured workout every day, but move your body in a way that brings you joy or something that you will look forward to doing. Because it'll be so much easier to do it if it's something that you actually want to do.
Absolutely.
Maybe it's like getting into a practice of stretching midday or before you're winding down for bed. And speaking of bed, prioritizing good sleep and getting at least 7 hours is really, really important. It's just really hard to feel our best emotionally and mentally if we're not getting enough sleep. So take a look at your sleep patterns there.
Yeah.
And then one last tip I wanted to mention. I know many of us can get into more of a routine at night doing passive activities such as watching Netflix or scrolling on social media. And those are really great ways to unplug. But I encourage you to think about putting the active in activities and think about the things that you enjoy or bring meaning to you, whether that's talking with your friends or loved ones, volunteering, spending time in a park, working on a puzzle. Just if you've noticed feeling stressed and have found yourself in a bit of a rut in terms of how you unwind at night, I challenge you to think about how you might make a change there and how you spend your time and see how that changes how you feel.
That's really great advice. And I'm actually going to take that advice home with me because I know my nighttime routine is unhealthy. I scroll TikTok and it's to the point where it's doom scrolling, essentially. And it's very unhealthy. And actually, I kind of want to touch a little bit on TikTok and mental health. My personal belief is that I don't believe the human should go through so many emotions in such a short amount of time. Because on one TikTok, I'll be laughing, smiling, and then the next one, there's a dog that was lost, can't find its owners, and now I'm crying, and now I'm laughing again. So when it comes to mental health, how is social media tied into that? We know it's not healthy, but tell it to us for real. Is it really that unhealthy?
The first thing I think about as you mentioned that is that these videos are very short and very attention grabbing. And our attention is kind of being shaped by these short, very entertaining videos. I've heard from so many people that it's difficult to watch a full movie now because they're used to just the little bite-sized videos that they see on social media. So I'm curious as to what that might look like years down the road after we become even more and more accustomed to these types of reels and videos. And another thing I want to mention too is that social media it's wonderful in so many ways, but there is a lot of misinformation out there, in particular when it comes to mental health. And I just would caution folks to take a grain of salt with the things that they see and consume. But it's so hard because there's a lot of positives to it too.
Absolutely. Let's kind of lean into those negatives. What are some trends or things that you have seen that, kind of put a red light on and you're just like, I don't really know if this is great advice for people?
I'm seeing some videos that are suggesting diagnoses based on maybe a couple of different signs and doing that, in a self-diagnosing sort of way. So if you're wondering about a particular diagnosis or symptoms that you're feeling or behaviors that you're noticing in yourself, definitely best to talk about it with a professional before self-diagnosing. We used to talk about searching on WebMD and deciding that the worst possible scenario was what was going on.
Exactly.
Yeah.
So it could be very similar there to self-diagnosis. And people can actually start hindering their health by trying to apply tools that maybe don't really belong to them or that they need. And so maybe they're trying to diagnose, or they've diagnosed themselves with something and it's just the opposite end of the spectrum. It could be similar, but they're actually doing more harm than good by just leaning into something that somebody, a professional, a licensed person hasn't said, okay, like this is what you have. Yeah. That could be very dangerous.
Yeah, absolutely.
But
and I'm also noticing that TikTok can also interrupt sleep. I know there's a lot of people that are doing it right before bed, and that blue light is telling our bodies to stay awake.
Yeah.
I've also heard that it's meant for many the first thing that they do in the morning too. So, just be mindful of your social media consumption.
Absolutely.
Just like anything else, it can get out of control and take over and distract you from other things that are important to you.
Absolutely. And in your line, or like, how long did you say you've been practicing therapy now?
Just over 10 years.
Just over 10 years. So have you actually seen the differences in like a pre-TikTok world versus the post-TikTok world when it comes to mental health? Is there a difference that you've noticed?
I'm not thinking of anything off the top of my head right now.
That could be good. That could be very good.
Yeah. Yes. But,
okay.
When I started working, this is before dating apps were big and before everyone had a smartphone. It's wild to think how much technology has changed in a relatively short amount of time, and how most of us communicate so much on a phone. It's just kind of interesting to think about
Absolutely.
how a piece of equipment has changed the way we interact with so many people.
And interact with ourselves as well, or how we think of ourselves, I would say. Have you noticed a difference in how people approach therapy now in such a social media encompassed world versus how they did maybe, say, 7 years ago or 8 years ago?
Sure. I'm definitely seeing and hearing people talk about Instagram and, the standards of beauty that they see, and comparing themselves to other people based on what they see on their social media, and kind of holding themselves to unrealistic expectations. That is definitely something I didn't see at the start of my practice. Wow. And because we spend so much time on social media, that is kind of like the message in their face, like, you're not enough, you're not skinny enough, you're not exercising enough. It can be really damaging to kind of get those subliminal messages.
Absolutely. And consistently getting those subliminal messages. Absolutely. What would be a cool tip or trick that you could share from your profession that would help somebody who's maybe indulging too much in social media and really taking on the persona that I'm not good enough or I'm not fit enough? What are some tools to help us separate that social media from reality? What's something that we can do for the self?
First of all, and this can be hard, is just kind of getting real with yourself about how much time you're spending on social media and creating some boundaries for yourself. I know that's a lot easier said than done in practice. But I think another thing where therapy could be particularly beneficial is looking at some of those messages that you're getting, and what is it that you're telling yourself? What is the conclusion you're drawing by looking at these different profiles or pages or your feed? If you're telling yourself, I'm not good enough, where is that coming from? That message is not productive or healthy, probably not true. So can we challenge that in a way? Can we pick it apart in therapy? Can we reframe it? Because those messages, they stick with us and they make us feel poorly about ourselves. So in cognitive behavioral therapy, that is kind of a huge thing in what we do, is dissect and identify patterns in our thoughts, and reframe how we're talking to ourselves, and in many cases, just being kinder to ourselves.
That's incredible. And this is CBT. We usually, if people are talking about this is CBT, what they mean. Okay, that's really impressive. Okay, I know just a little bit about it, and now just from what you said. But how does CBT differ from other types of therapies? What's kind of the main difference there? If somebody was looking to go to therapy and they saw CBT on the door, and they were like, "Is this for me or is it not?"
CBT, cognitive behavioral therapy, it's really looking at your cognitions or your thoughts and your self-talk, how that influences the way that you feel, and then how that influences the way that you behave. So it's really taking a look at your thoughts as the most important piece. CBT stands out because there's been the most research done with it. It's sometimes seen as the gold standard because there's been so much research done and it's been shown to be effective, sometimes as effective as medications. So you'll find that many practitioners use it and have been trained with it, but there are so many different other modalities and approaches. I know CBT isn't a great fit for everyone. It's not everyone's cup of tea, or it just like doesn't sit right with somebody, and that's totally fine and totally valid. But if you're looking for a very cognitive, let me look at my self-talk, let me try to be kinder with my words to myself, sort of approach, CBT might be right for you.
That's really awesome. And I like the approach being kinder to yourself, because I think everybody needs to be a little bit kinder to themselves, especially in today's world. And so whenever it comes, so people can choose a different type of therapy, but maybe before they choose the type of therapy, how would somebody know that? I mean, of course, as you said in the very beginning, everybody should go to therapy, but not everybody is going to go. And maybe somebody's on the borderline, like, do I need it? Should I go? What are some maybe subtle signs that somebody should, pick up on in themselves that says, maybe you should consider talking to a professional?
I think noticing that you're not feeling like yourself, and that feeling is going to be a little bit different for everybody, but are you noticing any changes where you might say, I didn't used to do this? So for example, avoiding your friends or social activities is one that I think people tend to recognize, but then maybe will say, well, I got busy or they got busy. It's possible there may be more going on as to why the person's feeling avoidant. Any changes in appetite, whether it's increased hunger or lack of appetite, can be a concern that something's going on emotionally. That's not so easy to see as it's happening. But I think really it's important to consider, if you're feeling off, is it a bad day, or is it more often than not always a bad day?
Has it been a bad year? Or maybe a few months.
And how many areas of your life is it impacting? Like, are you experiencing stressors at work and amongst your friends, at home? And so, I think taking a look at the severity of what you're noticing, and then the persistence of it. So has it been just one day, or has it been a week, a year? That can be telling. And just as an example, for generalized anxiety disorder, therapists will look at a specific set of signs and symptoms, and they'll look at, how have you been feeling over the past 6 months? And of the past 6 months, have you been feeling these signs and symptoms more so than not? And so that 6-month kind of time frame is really indicating, like, is this persistent? And I think kind of taking a look at yourself and being real, like, how long have I been feeling this way? Can be a helpful question to ask.
But also, it's, as women, it's a little bit harder for us, is it not? Because, we do have the hormones and we have the fluctuation. And if you have a natural cycle, then you're going to feel those hormones more. We do have PMS, and there is the extreme case of PMDD. And on top of this, we have to worry about perimenopause, menopause. And these are all things that causes changes in us as well. How would I know it's not just my body and it's my mind that's that subtle difference,
It can be so tough because our physical health and our mental health are so interconnected. This is a really good question, because I think it can sometimes be really difficult to tease out why am I feeling the way that I feel? We hear this buzzword mindfulness a lot, and that's what's coming up for me, is thinking about just kind of tuning into your body. What are you noticing and what feels different? How long have you been feeling this way? And maybe just trying to check in with yourself a little bit more on just, when do I feel most like myself? And if there's something different, what is that? Where is that coming from? And then the piece of like differentiating, is it my body or is it my mind?
That's
kind of check in with your thoughts using something like journaling. Therapy is another great tool to kind of speak what your thoughts are saying and get some feedback. So
That's
definitely
great,
a complicated thing to tease out for sure.
Yeah, it's hard being a woman. We know it, like it's not easy. But I think it's really interesting. So it's kind of like which one came first, the chicken or the egg? And whenever you're feeling, or at least for me, I could be projecting, when I'm feeling bad physically and mentally, how is that? How are they so tied into each other? Like, I don't work out, so I'm mentally bad, but I'm mentally bad and I'm not going to work out. I feel like, do things usually manifest physically for people first and kind of puts them into a slump, or is it more mentally first and then they kind of go into that slump? Which came first, the chicken or the egg, the physical or the mental problem is, I guess, what I'm asking.
Yeah, that's such a good question. I wish I had a more straightforward answer for you. I know for many people, they can notice more of the physical symptoms first, whether it's, sweaty palms or racing heart, before they even recognize what is it that I'm anxious about. I'm thinking about a client who mentioned having a job interview and was having their tummy was upset the night before. So like well before even like feeling this job interview is going to happen. So I think for many, it's almost easier to recognize the physical symptoms. Sorry, I don't have a really great
No,
way to
it's
wrap up on
okay.
that.
No, it's okay. It's so, because it's hard to answer, because sometimes maybe it manifests physically first or mentally first, but it's so, like you said, it's intertwined, our physical and our mental self. Like they're one and the same, basically. So yeah.
Absolutely.
It's hard to say on that one. Yeah. How is it being a therapist? Because you listen to everybody all the time. Does somebody listen to you?
Well, of course, I have my own therapist.
Oh, great. Great.
Yeah, I get that. I get this question a lot. And I think therapists have to be special people that enjoy doing this type of work. It's very meaningful to sit with somebody and to hear some of their most sensitive and most vulnerable thoughts and feelings. Like other professions where it can be heavy, just having really good self-care, having my own therapy is really helpful. And for me, just being a therapist kind of fills a cup in a certain way, because it just feels so rewarding. So it's probably not the right profession for everybody, but I think taking really good care of yourself is an important piece.
How do you take care of yourself?
I love to exercise. I walk my dog in the morning. I like to do yoga and Pilates and go for hikes. Just being outdoors is huge for me. Being outdoors allows me to be a little more present. I can put my phone down a little bit more easily and just take in the colors and the smells and the things that I see. And so being outside is a big one for me, to just give my mind a break and to unplug. Those are my main ones. And then prioritizing sleep is huge, because without a solid 8 hours, I'm cranky.
Yeah, I understand that. Sleep seems to be the thread that just aligns all of our podcasts together. Everybody we talk to has always talked about the importance of sleep, and it started with this one guest we had, Dr. Smita Patel, and ever since then, everyone's like, sleep, 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 sleep. You would think we should be sleeping 24 hours a day with how much sleep we've been recommended, but yeah, you can actually have too much sleep, ladies and gentlemen, but we won't get into that. But that's really great that you have time and you've carved out a plan for yourself, or a way to take care of yourself. Because I imagine listening to people all day, I'm not going to say I'm an empath, But I know when my friends are leaning on me really heavily, it's really hard for me to be there and be present. So how do you stay present for your clients, especially on those hard days?
I think it's really sitting with the client wherever they're at and really actively listening. It can be really easy to go where your thoughts want to go, but really just bringing it back to what's going on in the room, or when it's online, the Zoom room,
Right.
um, and kind of just centering it around the client experience and with the focus of what is the goal here? What does the client need from me? Just really bringing it back to a very client-centered sort of approach.
Mm-hmm. And what usually is the goal for therapists when they're sitting with their clients? Like what's the goal?
Usually in the first or second session, we'll talk about that with our clients and kind of be aligned on what is it that they're hoping to get out of therapy. What do they want to be working on? Knowing what topics are important to them. But my goal in those types of moments where it's really heavy is just for the client to feel heard, to feel seen, to feel validated. That in itself is so huge. So, really having that goal in mind, but with the client's larger goal as kind of the North Star.
That's great. Yeah. And when you say feel validated, what is, just to kind of explain it to our audience, what is that feeling validated?
So, when you're feeling something, I think we sometimes question ourselves with, should I have felt this way? Should I have been feeling something different? Am I justified in the way that I experienced this thing and had a response to it? And our feelings are valid. We're people and we're imperfect and we have baggage and we have expectations. So I think just allowing someone to share what their experience was and have someone hear that in a non-judgmental way can feel very, very validating. And I hope that makes sense.
Absolutely. Yes, it makes so much sense. Yes. But what was it that attracted you personally to being a therapist? What was your journey like to get there?
It's like many others in my field. I had a very powerful experience being in the client seat. And I just thought to myself, if someone can do this for me, how rewarding would it be to be this person for so many other people? In college, I took a few psychology classes, and they were the ones that just I wanted to read more about. I wanted to read the self-help books that were kind of like adjacent to the subjects I was learning about. I really love sitting down with people and listening to their stories. So it's a really beautiful thing, therapy. It's, every relationship you create is a little bit different, and everyone shows up a little bit differently. It's just really fun and super rewarding.
And what would you say the biggest challenge you've faced so far in your profession has been?
Just thinking a little bit more globally is noticing how difficult it can be for people to access care, whether it's navigating an insurance system or the long wait lines, or I grew up in Wisconsin, and there's some pretty rural areas where it would take a very long time to commute to the nearest person, let alone the person that might be your best fit or have the expertise that you're looking for. So I think just the lack of access, the lack of available options for people is hard to see.
But that's where BetterHelp comes into play, right? And so they're giving that accessibility to people. I think
it was really designed with accessibility in mind, and I think that's one of the main reasons why I was drawn to BetterHelp in the first place. And really, with anybody who has a smartphone or a computer with Wi-Fi, you can talk to a therapist, which is pretty fantastic. Another thing I really like about the platform is that we have phone sessions and live chat sessions. So there's some people that might feel a little anxiety around meeting with somebody over video, and so they can talk with somebody over the phone instead. Or if you live with family members or roommates and you don't have a private space to talk, you can chat and text and say whatever it is that you're really thinking and feeling. So online therapy has opened up some creative and different ways to communicate in that way.
Absolutely. And maybe how we communicate via online is not how we would communicate via video. So having those options is it's really great. And maybe we don't need to have a mask when we're typing versus video. I think that's really great. I think BetterHelp is doing great things. I really enjoy using it. I am a fan, but I'm also a fan of accessibility of anything, as being from the US myself as well. Like, just we don't always have access to the things we need, which is a shame. So I'm really glad that companies like BetterHelp and Bellabeat bring that accessibility to people. So that's really great. You had mentioned while you were in school that you were reading a lot of like self-help books. We like to ask all of our guests, what are some books or maybe publications that they like that maybe our audience would want to read?
I really like this book called Feeling Good. I'm looking at it. It's on my desk right now. The New Mood Therapy. It's by Dr. David Burns. He was a psychiatrist at Stanford, and he did a lot of work with cognitive behavioral therapy. He was trained by the father of CBT. So he has a really great book kind of going through the tenets of CBT and exercises of like what to do with unhelpful thoughts and how to identify thought patterns. So that's one that I always recommend is Feeling Good by David Burns.
That's great. I'm going to check that one out just because it sounds really interesting. And the way you've talked about CBT has been really interesting to me as well. So I'm definitely going to look at that one out.
Awesome.
And we also like to ask people, what are 3 things to begin doing? And what are 3 things to stop doing? And we're going to frame this one around mental health and therapy. So what are 3 things to start doing? And saying going to therapy, we can't use that one yet. Or we can't use that one. So 3 things they should start doing and 3 things people should stop doing, in your opinion.
The first thing I thought about with the start doing is reaching out to someone that you love. Time can slip away from us, and maintaining connections is really hard. And I've heard from so many people in the client seat that they just wish people would reach out more and they want to feel more connected. And I think taking the initiative can feel hard sometimes. So muster up what you need to and do it. It'll be worth it. It feels really good to get in touch with the people that you care about. Whether it's text or phone, whatever feels right, just something to keep the connection alive.
Absolutely. That's good.
Another start doing, I have to talk about sleep, and it's just get to bed 10 minutes earlier than you normally might, just for a little extra rest. Anybody can change their routine by 10 minutes.
Yeah.
And really, hopefully that time might even allow you to brainstorm, what else am I doing with my nighttime routine that is hindering a good night's rest? Or what else could I be adding to my nighttime routine to unwind in a little bit more productive way?
Absolutely.
So go to bed just a touch earlier. As you mentioned, there's some people that maybe don't need more sleep, but most of us could use a little extra.
I know I can. So.
Me too. And then my last one is to take 5 minutes out of your day to practice breathing and just to listen to yourself breathe. We all have 5 minutes that we can spare from somewhere, and breathing can be a really powerful tool. It's something we have with us all the time, and it can help regulate how we're feeling. If you're looking for something a little structured and guided, there's a lot of resources on YouTube. Really just counting to 10 and kind of noticing how your breath feels in and out is a really great mindfulness exercise, and something you'll have when you're at a traffic light, when you're at the grocery store in line. Something that can help slow the heart rate down and signal to your brain, I'm trying to relax. So a really powerful tool that we all can practice and cultivate.
We actually have some breathing exercises in our app, and different breathing techniques, the 4-7-8, the balanced breath, double breathing, equal breathing. And so we have quite a bit of things. So people, if you're listening to this, be sure to check those out in the app, Imperial Diary or Bellabeat Coach. And now for your 3 things to stop doing.
Yes. These revolve around getting a good night's sleep again and being mindful. You'll notice I have a few kind of focus areas here. So first thing is to stop bringing your cell phone or tablet or laptop into bed. I know it's really hard, and it's usually our alarm clock, and it's how many of us have our cell phone within arm's reach right now? Probably all of us. So kind of learning to sit with discomfort of having it a little bit further away and allowing yourself to be unbothered and not distracted by it when you're in sleep mode. If that is really hard for you, which it is for most of us, stop scrolling first thing in the morning, whether that's through your mail, through social media, the news, whatever it is, it probably can wait. And just rethink, what can I do first thing in the morning that will set my day in a way and set the tone in a productive and positive way.
Yeah.
Because like you said, that doom scrolling can often bring on stress, negative feelings.
Yeah. And right at the start of the day, that's just not a good way to start. Like, yeah.
Absolutely not. So, no.
Maybe start with some affirmations or something that might be
literally anything else. And like I said, all that stuff all that stuff will still be there, when you check it later, but give yourself a moment to focus on yourself first. And then my last stop doing is to stop eating mindlessly. So for many of us, we're eating on the go, we're eating in front of the TV, we're texting or playing on our phones while we eat. And it's really not a great habit to get into. So challenge yourself, sit with yourself and really taste the food that you're eating, and how does it feel when you chew, and kind of get into your senses and notice things a little bit more. Be curious about what you're eating, what it looks like. Easier said than done, and I know it can seem kind of silly to do, but just try it. Why not?
You have nothing to lose by just trying it. So yeah,
nothing to lose.
I think those are really great tips. I really love them. And I love that sleep and mindfulness has just kind of threaded itself throughout as well. Sleep is just our number one theme for all of our podcasts. So it's obvious that it's a very important thing to have and to get enough of. But Melissa, it's been so wonderful talking to you. I think it's really incredible what you're doing. Props to you. I think it takes a really strong and special type of person to be a therapist. And so thank you for what you do. And I'm sure your clients thank you for what you do and for the help that you've given them. And thank you to BetterHelp as well for being available for people to have access to online therapy. But biggest thank you is to you. I just want to just give you my heart. This was a really lovely conversation, and I learned a lot, and I have a new book that I'm going to check out as well. So thank you for that recommendation. For all of you listening or watching, make sure to like, subscribe, and to hit that bell icon on YouTube so you can know when we're going to put out our next episode. Other than that, Melissa, do you have anything you want to add?
Just thank you for having me. This was so much fun, and I hope the listeners have some sort of takeaway that they'll try or find useful.
Absolutely. There's a lot on this podcast plate that they can eat from. So I think that's really, really great. Awesome. And thank you guys for listening.